The West African Society of Parenteral and Enteral Nutrition, WASPEN, has called on the federal government as a matter of urgency to address the menace of malnutrition in Nigerian hospitals. WASPEN President Dr. Teresa Pounds made these revelations while addressing an online press conference to raise awareness of the association's 2025 WASPEN Clinical Nutrition Conference, which is due to come up in June.
So we want this message to go to the president for us to really have such initiatives in place. We want the Federal Ministry of Health and State Ministry of Health to really have their efforts to focus on malnutrition and come up with several different kind of initiatives to make sure that this is done.
Dr. Pounds noted that many patients in Nigerian hospitals suffer from inadequate nutritional support, especially after a surgery, which most of the time resulted in death.
If we look at patients who have probably lost their lives, in fact, there was a very sad case that happened in Lagos, a young boy that had surgery. I think that's a good example of what I'm talking about. He had surgery, and it was mentioned that when he had surgery, that his intestine was stolen. What they did not understand is that his intestine was not stolen. He had surgery, he had complication of surgery, and they had to cut some of his intestine due to that complication. So he ended up with what they call a short gut syndrome, meaning the length of his intestine is not the normal length, meaning the only way this boy could stay alive, could have nutrition, is IV, intravenous, meaning whatever he eats, like me and you eat, is going to go right through him. It's not going to be absorbed.
She charged the government to tackle the menace quickly so as to reduce avoidable deaths in Nigerian hospitals.
First of all, these key stakeholders, the Ministry of Health, all these people that are called, the president, they need to be aware that hospital malnutrition exists, and then it trickles down. So the leaders, the leadership, the leaders, the key stakeholders, the hospital administrators, the healthcare professionals. We need to look at education, nutrition education in medical schools, in pharmacy schools, in nursing schools, in the school of dietetics. Nutrition has to be in the curriculum for medical schools, for nursing schools, for pharmacy schools, and also the dietitian.
Dr. Pounds said that WASPEN is working to establish steering committees in major institutions to ensure the advocacy reaches the target audience.
So my big thing I'm doing too is advocacy. And that's also one of the reasons why I'm choosing LUT. I'm choosing National Hospital. Hospitals where I know they have connection, that the people that are in those positions to make decisions are probably affiliated with them.
The conference, with its theme, Bridging the Gap, Integrating Hospital and Community Malnutrition Care in Developing Countries, would have the National Hospital Abuja as the host.